We have become quite familiar over the last several years with new forms of immunotherapy in multiple myeloma, primarily with monoclonal antibodies. Indeed, the first monoclonal antibody we had to use was Daratumumab, which is an anti-CD38 antibody, and we've been using it as single agent and in combination for many years. More recently, we've had another CD38 antibody join the sphere, Isatuximab, which is a relatively similar agent to Daratumumab. And so challenging questions often come up about, should I use one or the other? What are the pragmatic differences between them, and how do I sequence them? When we think about these two agents, why you would select one over the other, one has to look at the indications for use of these. So this can vary by country, but in general, daratumumab we've had as a single agent and now in multiple indications as in combination with many of the agents we use, such as lenalidomide, bortezomib, carfilzomib, and pomalidomide. Isatuximab is approved more in combination with either pomalidomide or carfilzomib. The two agents are very similar, but there are some important distinctions. Daratumumab is a lengthier IV infusion, although most recently now there is a subcutaneous formulation. Whereas isatuximab is a shorter IV infusion, a little over 3 hours for the first infusion, approximately 2 hours for the second infusion, and subsequent ones are only 75 minutes. Daratumumab is infused weekly for 8 weeks, then every other week for 16 weeks, then every 28 days, whereas isatuximab is given weekly for the first month, then every other week thereafter. But perhaps the most challenging question that comes up with CD38 antibodies is, can I reuse it or can I switch from one to the other? I had the privilege of recently publishing some of our work looking at this exact question, where we took patients who were daratumumab refractory and gave them isatuximab and learned that we can't really rescue one with the other, meaning that we don't expect one to overcome the resistance of another. So the general recommendation is not to go from one CD38 to another or to immediately reuse it in a patient who's progressing on it. There is some evidence that if we give patients a 6 or a 9 month holiday for perhaps using a different regimen that doesn't include a CD38 antibody, we may be able to either reuse daratumumab or isatuximab or switch from one to the other, but we're doing those confirmatory trials right now. I trust that this will help as we think a little bit more about how we use CD38 antibodies as they become so prolific in our use of them in multiple myeloma.